This is Hayden Bush for Hospitals and Health Networks magazine. I'm here today at Mount Sinai Hospital in Chicago for a look at our One Percenters series, which is focused all year long on strategies for better treating the patients who generate the highest amount of healthcare costs. At Mount Sinai, multidisciplinary teams focus in on patients with diabetes, heart failure, and other key chronic conditions in an attempt to reduce patient readmissions and ultimately change patient behavior. I talked with Tina Spector, Mount Sinai's Vice President for Quality, about the overall strategies Mount Sinai is employing to focus on this critical patient population.
We also joined into the Project RED program with the Agency for Health Research and Quality and put together essentially what has become a chronic disease management program for Sinai Health System. For heart failure, we had a relatively high readmission rate, and through the efforts of all of the concepts of Project RED, we were able to initially reduce our readmission rate by something like 65%, but over time we've sustained it at about 45%. And it really means a lot in terms of achieving the triple aim because the patient is at the center. We know that by avoiding readmissions, we are reducing costs. At this point, I would say that we are very focused on those patients that are the most difficult to take care of in the health system. It's really those patients that are frequent flyers, who might have drug dependency, alcoholism, who don't have good support systems in the community. When a patient first gets admitted to the hospital, then they are seen by a pretty comprehensive interdisciplinary team, which does include a disease manager, a navigator, a social worker, a dietitian, and even a physical therapist. Following at discharge or on the way to discharge, we make sure that they have a primary care physician, and if they don't, we work with them to choose one. And then through talking with them, we learn about their abilities to take care of their needs in terms of transportation, whether or not they're able to get their medications, all of the things that we know they're really going to need to help them be successful in the outpatient arena.
Mount Sinai patient Valerie Shavers has been enrolled in the Project RED program since 2011, following an episode when she lost consciousness and was diagnosed with congestive heart failure. Valerie, who was recently rehospitalized with complications related to her CHF, spoke with me about how the team approach has really helped her.
If you had a team like this come in and you just had surgery and somebody come in and smile and just ask you how you feeling and tell you, well, if you need anything, call me. Because you got a nurse definitely and you're going to get a doctor definitely. But you're not going to get a team that's going to follow you, make sure you do what you have to do.
Disease managers like Victoria Thompson are key to Mount Sinai's team strategy, building trusting relationships with at-risk patients in the aim of ultimately facilitating healthier choices.
Yeah, we do. We try to go at it at a little personal level to try to get that trust. So if we tell them we're going to call at a certain time, we actually call at that time. If something falls through, then it's on them to explain. But trust is very important in dealing with the clientele.
Valerie relies heavily on her disease manager, Rolene, to help translate clinical information and support her in times of crisis.
So if Rolene come in and the doctor and told me, well, your RNC is something, and I asked him what it is, and he explained, book. So I asked Rolene, girl, that's just your blood count. That's all they need is your blood count every day. And that's how it goes. They always are there. Always. And I'd suggest if I'm in the hospital and it's a patient next to me with the same problem, I whisper to them, hey, that person's going to need you. Because I feel like they do great. They come in with a beautiful smile no matter how bad you're feeling.
This has been Hayden Bush for Hospitals and Health Networks magazine. For more information, visit hhnmag.com/1%.